Hello everybody, Dr. John Waterhouse again, and welcome to day 3 in this 7-day series. Now, day 1 we talked about really leash training and leash walking etiquette. Day 2, or yesterday, we talked about movement and the importance of doing passive range of motion exercises with your pet on all their limbs and their joints of their limbs. Today is day 3 and we're going to talk about strengthening. And strength is the number one thing that your pet will start to lose first. And really we should say it's muscle mass. And we know with our geriatric or older pets and also our adult pets that around the joint, as we age, we lose the ability to put on muscle and build muscle around that joint. We now start to get joint laxity. So if you lose the hip joint or the knee joint as an example, we now get laxity. That joint can now move. It's not held in tight, so it starts to move and we start to get friction and grinding. And that is what arthritic pain is. And so the longer that we're under isolation and lockdown, when it becomes weeks to months, the longer and the greater the chance that we're going to see loss of muscle mass and deterioration of strength in our pets. And now we're going to increase the chances of them developing arthritic pain and becoming uncomfortable and grouchy. And so we want to do everything in our powers to prevent that. And so we're going to talk about supplements and things you can do while we're in containment that can help your pet build muscle and strength. So down below in the description, I'm going to put a link to caninerehabondemand.com. And on that site, there will be a nutraceutical download PDF that talks about the top 10 nutraceuticals, but also in that it talks about 2 that are specifically designed for muscle mass and strengthening. One is called Myos, and this comes from a fertilized chicken egg, and the other is called Canine, and this is the inside of deer antlers, and it's a Canadian product. And both products are designed to help build strength, build mass. The Myos does it through muscle growth, and the Canine does it through a side effect of the anti-inflammatory of this growth hormone byproduct is that it increases the tensile strength of existing muscle. So these are 2 great supplements if you have a geriatric dog. I'm also in the 10-part nutraceutical series, I'm talking about glucosamine chondroitin, omega-3 fatty acids, other things that your dog should be taking to help with osteoarthritic pain if they are a geriatric or an adult dog. So go to caninerehabondemand.com, download your free PDF file so you can learn something, and then go, and if you still have mail services and you can order this on Amazon, click on the links in the store and you can order that direct from the company and have it shipped to you, because I think we're going to be in lockdown for weeks to months. And if we can start our pets on some type of nutritional supplement that helps protect their muscles, helps protect their joints, helps with pain relief, like durolactin, a microlactin supplement. We can be doing things to help supplement them, keep them healthy while we're going through this lockdown, because as they're not able to exercise fully, we now will have deterioration of muscles. Same with ourselves. We will notice that we lose endurance, we lose strength, we lose our conditioning. And this, as I've talked about before, happening with our pets. So if we can supplement in something to help them slow this process down, we're going to have a lot happier pet when we come out of this isolation. So also the video today that I'm going to place now after this is on massage. People have been talking about what other things we can do to our pet to keep them happy, to keep them comfortable, and so massage is a really great technique to do this. So the video will be talking about how to take your pet through massage. But this design is designed for a post-surgical or post-injury pet. And this comes from a Canine Rehab on Demand exercise program. And so this gives you some really good information about how to do this safely and how to do this efficaciously without causing pain to your pet. Now in this exercise called massage, this is one of my really favourite exercises that I do with any of my patients or my pets, because it's a really great exercise at building that human-pet relationship bond, because we're touching, we're spending time with our pet or our patient, and we're working different areas. And so massage is a great exercise that really is helping relieve stress and anxiety in the patient, because if they're a post-surgical patient, they're pretty anxious about the area that's had surgery. They've had an assault to their system, and so they can be a little anxious and a little bit worked up. Oh, is that right? Are you anxious, are you? Yeah, so this is a great exercise at just building that bond and having fun with your pet. So the big things, as I said, massage is there to be fun. We should not be fighting. We should not be working and fighting against them to keep them in place. We should just let them do their own thing. But this should be a fun exercise for you and a fun exercise for them. Now, this helps with stress and anxiety, but also for post-surgically or surgical patient, this is really good for edema and swelling, helping get rid of edema and swelling. Also, it's great and it helps get rid of pain in that area. When we're dealing with dogs post-surgical on a certain area, massaging around that area, and that helps prevent scar tissue and adhesion formation. So that's really important, say for dogs that have had femoral head osteotomies, TPLOs, for example, total hip replacement. It helps stop that adhesion and that scar tissue formation. So this exercise is really great at keeping muscle tone, and for those dogs that have cage rest or splint, it can help prevent loss of muscle and muscle atrophy, slow down the process. Because it increases blood supply to the area. Post-surgically, it also helps with swelling. Now, it's really important before we do any massage in a post-surgical patient, especially in the first 2 weeks after surgery, that we be very careful around the surgical site. And so here, this dog has had no surgery. So I want to demonstrate what you would do if he had a surgical incision. And for that, I'm going to use this as just a guide, a marker. So we'll kid, this is a surgical incision, this blue line and this blue tape. So when we come home for a post-surgical animal, we want to stay away, especially for the first 72 hours, we want to stay away from the incision line. We want to keep it clean, we want to keep it sterile. When I talked about cryotherapy and the importance of cryotherapy, I said put a little bit of Glad wrap over the incision before you put your moist towel and your ice pack down, because we want to keep that surgical site sterile. So when we're massaging the area, we don't want to massage over the site. We don't want to go anywhere near, we don't want to pull it apart, we want to stay away from that site. And people think 12 to 14 days after surgery, the sutures are removed, oh, I can start massaging there. No, the suture line is still very gentle and very delicate, and we don't want to do anything across that site that pulls it apart. So for post-surgical massage, it's important that we massage back towards the body, because we want to bring the blood flow back. We want to bring all the inflammation, the swelling and the lymphedema, and we want to work it back towards the body. Every other time you're massaging for relaxation, for muscle well-being, we massage away from the body. We massage down and work with the muscles. But for post-surgical, especially for the first 2 weeks, you want to massage towards the body. And just nice light strokes. No kneading or grabbing or deep massage work. It's just nice effleurage strokes back towards the body, and that just helps bring the edema and the lymph back into circulation and getting the swelling out of that limb, because we know the limb, really I call it a dead end. Nothing's going, all your blood flow goes down and comes back, so we want to get the edema and everything that builds up in this leg, and we want to pull it back. Also, this is a great exercise in helping touching around the area, getting them used to being touched in that area, because this area is sore. Over the next 12 weeks, we're going to be doing a lot of rehabilitation on this area, a lot of touching, a lot of movements. And so just placing your hands on that area allows them to get used to you just touching and playing with that area. And that's really the importance of this exercise, especially in the first 2 weeks after surgery, is just getting them used to people touching that area, playing with it, and just nicely caring it. So nice, steady strokes for that area. When we look at the front limb, so this is just normal massage for non-surgical, so we're massaging down towards the leg, just nice gentle strokes going down. This should be relaxing. Anytime they show any discomfort, any pain, this is not what you want. If they're fighting or showing anxiety, this is not the outcome of this exercise that we want. We just want it fun. We just want you to sit there and just slowly work and just run your hands down the leg. That's all we're doing, down their back. They hold a lot of stress in their back. So we just want to rub your hands. If they sit up, we massage their shoulders, because really you want to think of your dog as a total system, not just the limb you're working on. And with the exercises like the three-legged weight shifting exercises, you will see that they weight shift, their whole body is involved. And if this leg has had surgery or some type of injury, they're compensating elsewhere in the body, so they'll have tight muscles. So we just want to play with them, run your hands everywhere over them. As you can see, he is hating this. This is very painful. And I'm only joking there, but you just want to make it a fun, loving experience between you and your pet. And so this exercise is fantastic for that. So just running your hands over their back, over their body. But as I said, if this is a post-surgical limb, say, good boy, just like that. So as I said, if this is a post-surgical limb, we want to support the limb and slowly just bring our hand and rub back towards the body. So if we take our little blue tape, and I put the little blue tape there as a marker, so we don't want to go near the incision line. We just want to drag our hands, hold and support the site, and just slowly bring, as my tape is running up, is sliding off, but you get the idea of the cue. You want to just slowly bring your hands up and effleurage around, and just nice gentle strokes, just bringing that, helping that lymph and that edema come back. So as I said, non-surgical legs, you want to massage towards the end of the limb in lovely strokes. If it's a surgical leg, oh, good boy, you want to then massage up the limb. Same with the hind limb. If there's a surgery, a non-surgical limb, you want to just massage, oh, here we go. There we go. With post-surgical limbs, we want to massage down, nice stroking movements down the leg. And then if this is a surgical limb, remember we want to just nice stroking movements coming up the limb, staying away from the scar tissue formation, and just work our way up and nicely stroke that limb. So I really encourage you, if you aren't subscribed to this series, go click on the subscribe button below. Hit that bell, because that's going to notify you about all the other presentations coming in this presentation series. So until tomorrow, be safe, keep your family safe, keep your pets safe and happy, and I look forward to seeing you tomorrow. Bye-bye.